not having the human-to-human transition is a big reassurance, and now we want to focus on what ways can we prevent this transmission further and make sure that we're keeping ourselves safe.
Yeah, let's talk about that long term. I mean, it's not the first time we've heard of avian flu, of bird flu, right? You go to the supermarket, and in a lot of places, there's a shortage of eggs, and a lot of the link there is bird flu. At what point can this start to abate? When does this line flatten, if you will, to try and get back to normal?
You're absolutely right, Marina. So there's been actually, these outbreaks have been happening since 2022, but because now we're hearing more about it in the more recent past, because we're seeing several different species being infected, and of course is giving us reminiscent vibes of COVID days. And one of the ways that we can help flatten this or prevent this from going further is doing some things that we can make sure that we're doing. For example, having the flu vaccine, the influenza vaccine, is actually critical in this stage. Folks are able to take that step of vaccination, and then two, we're also being advised from foodsafety.org of having the 3 C's: cook, clean, and chill. Cooking food thoroughly is very important. Cleaning the surfaces and making sure that we're not having infected areas is really key. And making sure that we're refrigerating all our food to a very stable temperature is also important.
All right, good information there, especially as we see a lot of people also with other viruses and bugs of that sort. So for the gastro area, cooking it, keeping everything clean, and washing hands.
Put it away.
Yeah, critical there. More context.